been up since.
Fantastic. Okay, all right. Well, welcome along. Hello, everybody. This is Kathy Frey from IMCO, from the International Integrative Maternity Healthcare Organisation, and welcome along to this week's webinar, our Maternity Natural Health webinar. And a big welcome to Raya Kusari. Say hello.
Hi there. Happy to be here. 6 o'clock in the morning in Queensland.
Oh, is it 6 o'clock?
Yeah. No daylight saving.
7 o'clock there. Oh, no daylight saving. Oh, it's even a bit earlier for you guys.
I've had a coffee.
So it is an early start. And welcome along, Raya. I'm very excited to have you here today talking about the topic of homeopathy, and which is a modality that's close to my heart, and such a useful therapy throughout pregnancy and labor and postpartum, and just wonderful. So it's really great. It's been a little while since we've had a homeopath going over some good remedies and practical stuff, and that's going to be so great. So welcome everybody along to this. And just a little housekeeping while other people may be still signing in. Wherever you are in the world, we'd love to know that, and your role as a health professional, or maybe you're a mum expecting a baby, or maybe you're both. And so there's the little chat area, usually at the bottom of your screen. If you want to type in there and let us know where you are, that would be great. It's always good to know. And also just a reminder that down the bottom, usually of your screen, will be a button that says Q&A, question and answers. So if you've got any questions for Raya during this webinar, please just type them on in, and we'll absolutely make sure that we go over that. So the format today is that shortly I'm going to be handing over to Raya, and she's got a beautiful PowerPoint presentation that she's going to be going over with you. So just a little bit of an overview for those of you who may be watching this later down the track, and you may not have seen the full poster on this particular webinar. So just a little intro about Raya. So Raya Kusari is a registered homeopathic practitioner, and she's the founder of the Hormone Clinic, which I'm sure she'll tell us a little bit more about. She holds an advanced diploma in homeopathic medicine from the Sydney College of Homeopathy, and she discovered homeopathic medicine through her own health complaint, which was resolved with homeopathy. Eventually, she decided to retrain so as to assist others with her with their health challenges, and her background is also in psychology and education. So Raya's been in practice now for about a dozen years, and has developed a focus on infertility and hormonal health complaints, and she's done a postgraduate training in infertility with a homeopathic gynecologist in India, because if you don't realize, homeopathy is huge in India. And so we're going to be going over today homeopathic medicine for pregnancy and labor and the postpartum. So welcome Raya.
Thank you. Thanks, Kathy. Happy to be here.
Yeah, so I'll let you take over the screen, and so that now Raya will be able to show you her PowerPoint and go over that with you. And welcome everybody here today.
Has that worked?
Perfect.
Lovely. Okay.
Yeah,
well, thank you for that warm introduction, and I've had a coffee, and I'm really glad that everyone's thank you for coming today. For me to speak about one of my passions in life, which is homeopathic medicine, as Kathy's mentioned. And this morning, of course, in particular, reference to pregnancy, labour and postpartum. I just wondered how many of you, if you could have a with homeopathy, either as a patient yourself, or you've utilised it in your family, or perhaps with clients. Any contact with homeopathy at all? If you can just put your hand up in the chat.
We've got 3 participants with their raised hands.
Yep, lovely.
4 going up. So
Yep.
yeah, raised hands, if you're not familiar with that, is there's a little button down the bottom of your screen probably that would show you that you can raise hands. So at the
Wonderful.
moment we've got basically, oh look, it's just going up in numbers. Yeah.
Yeah, great. Well, you're all in,
Fantastic.
and okay, so now I can't move to the next slide. Why is that? Oh, there we go. So you're in great company. People that have had experience with homeopathy are in great company. You know, American presidents, popes, Charles Darwin, Paul McCartney, David Beckham, the lovely people you see on the screen. They've all had utilized homeopathic medicines and advocated for homeopathic treatment. So you're in good company. Worldwide, of course, homeopathy is a form of complementary medicine, which we know is growing around the world. In 2006, the World Health Organization reported that there were 550 million users of homeopathy worldwide, which is heartening because in Australia, I don't think homeopathy is as well known as in New Zealand. Once again, New Zealand's ahead of the game. But from the Lancet in 2007, we see that 220 million users of homeopathy in Europe and India, as Kathy said, 100 million in India and 120 million in Europe. So 29% of the European population utilize homeopathy, and 55% of French GPs and 45% of British GPs refer patients for homeopathic treatment. And even more importantly, 75% of French midwives utilize homeopathy. So unfortunately, I don't have the statistics for New Zealand and Australia, but that's interesting nevertheless. In India, 200,000 homeopathic physicians and 150 homeopathic medical colleges. And in Australia, approximately 700 of us homeopathic practitioners. Sorry, I don't have the information for New Zealand. But as I said, I think it would be.
I'll just
yeah.
There. Yeah, and of course, this is a global conversation that we're having here. So yeah, New Zealand is does have high levels of understanding and appreciating of homeopathy in comparison to some other Western countries, but certainly I don't think any of us are close to Europe, UK, and India. The old British Raj travelled well to India and has been well and truly accepted there. So of course we're talking about, we don't have any statistics there about the USA or North America in general, and Canada, because we can have big audiences there as well. But my understanding is that the understanding of homeopathy in North America is very low.
I would say so, yeah.
But it's so interesting that there are still in existence in the UK, in London, homeopathic hospitals. So these are large, major hospitals where homeopathy in London is still part of the everyday plethora of therapies that they'll be making available to people. So anybody that sort of sometimes you think there's so much talk about homeopathy being a pseudo medicine, and so we're here to say it's not. And
exactly.
If you are in an area in the world that has that as a general idea, just know that a lot of other countries don't feel that way. Anyway,
exactly.
I'm just going to hand back to you. Sorry, I wanted to interject because, of course, we're not just got an audience here of New Zealand and Australia.
No, that's great. Thanks for that, Kathy. You know, and I mean, Melbourne used to have a homeopathic hospital. There were a lot of homeopathic hospitals in North America prior to the advent of antibiotics. But, you know, the balance sort of shifted. But now we can see how, you know, the overuse of antibiotics and people becoming concerned with some aspects of conventional medicine, you know, homeopathy might be on the rise again.
Absolutely. Sorry, I'll zip up and hand back to you.
No, that's great. Jump in anytime you want. So just looking at homeopathy and midwifery, because that's the focus for today, you know, they both respect the wisdom of the body and they're both holistic. And they both involve skilled observation of each woman as an individual. We're looking at, you know, how that woman is presenting and showing up with symptoms, and working with the body. So in that respect, they're a very good fit. And my first homeopathic practice in New Zealand was actually in a midwife centre in Rotorua. So I have huge respect for midwives, and like the amount of input and the time, you know, the night shifts and the, you know, the dedication to your clients is just amazing. So going on from there, just a quick look, I guess, you know, like Kathy said, homeopathy's been under the pump. And so maybe we're a bit defensive and trying to prove ourselves. But here's a bit of research from 2011, and it was a Swiss report and a very thorough 2-year review of the research on homeopathy. And researchers concluded that homeopathy is clinically effective, cost-effective, and safe. And the concluding statement in the report was that, in conclusion, we have established that there is sufficient supporting evidence for the preclinical as well as the clinical effects of homeopathy, and that in absolute terms, as well as when compared to conventional therapies, it offers a safe and cost-effective treatment. So just very briefly, how did homeopathy come about? It started with Dr. Samuel Hahnemann, who was a German physician, and he had a lot of integrity, and he gave up the practice of medicine because he felt at the time that they were often doing more harm than good. And fortunately for him, he was multilingual and he had 10 children to support. So he was translating medical documents to, you know, put food on the table. And one of those medical documents that he translated, they were talking about how cinchona, a particular plant, was the best treatment that they had found at the time for malaria. And in the article, the author had proposed that the reason that cinchona bark was effective was that it was bitter. And Hahnemann essentially wrote, what rubbish, you know, there are many substances in nature that are far more bitter than cinchona, and they have absolutely no effect on malaria. So true to his experimental nature and based on observation and true science, he got hold of some cinchona officinalis, and he took several doses of it over a few days, and he developed the symptoms of malaria, most of the symptoms of malaria. And he thought, that's interesting. And he left it for a few days and the symptoms resolved, and then he repeated it. Given that there was no ethics committee at the time, he gave some to his wife and 3 of the children, and they all developed symptoms of malaria, which resolved when not taking the cinchona. So Hahnemann identified that he felt that the mechanism of action of why cinchona officinalis, why this substance was helpful for malaria, was because of the law of similars. So this is the essential guts of homeopathy, is that like cures like. So substances which can cause symptoms of illness in healthy people. So Hahnemann developed the symptoms of malaria by taking cinchona, can be utilized to treat people presenting with those symptoms or having that condition. So a substance that might cause a left-sided migraine in healthy people, if it's taken repeatedly, can be utilized to assist people overcoming, you know, the complaint of having a left-sided migraine. Like cures like. So prior to Hahnemann, Hippocrates and Paracelsus had already identified this law of similars, but it was Hahnemann that utilized the law of similars into a form of practical application that we can use it as a form of medicinal treatment. So the other form of, the other principle or law is the law of contraries. So when you go to a conventional Western doctor, you're getting an antidepressant, an antihistamine, an antibiotic. You know, if you have a fever, they're giving something to bring the fever down, whereas a homeopathic medicine is going with the body and giving you something that would cause a fever in a healthy person and allowing the body to somehow recalibrate and reset. So just a quick example again, if we gave a double espresso like I've had this morning, if we gave that to a 7-year-old at, you know, 6 o'clock at night, good luck getting them to bed. I mean, they're going to be anxious, restless, hyperactive, running around, and they're certainly not going to go to sleep on time. So in the crude dose, you know, that can be the core, that caffeine can cause that effect for people. But in a homeopathic preparation, one of the remedies that we can utilize for anxiety and for insomnia, with the kind of insomnia where you go to bed and you just can't switch your mind off. You're thinking about what you have to do tomorrow, what you need to do, what you should have done. Coffea cruda can be useful for those nights of insomnia. So a quick definition of homeopathy: it's a system of natural medicine in use for over 200 years. We've yet to recall any of our remedies. They're made by homeopathic pharmacies, largely from plants, minerals, and animal substances. And homo means similar, and pathos means suffering. So it essentially means similar suffering, homeopathy. Back to the law of similars. So a homeopath is going to look at your totality of symptoms. We're interested, when we're working with a client, in their specific physical, mental, and emotional symptoms, the all-over picture. And we're matching that picture with a remedy picture, with the symptoms that a remedy can cause. So, so the unique way in which a person is experiencing a complaint, if you have a migraine or you have anxiety, and do you feel the anxiety in your stomach? Do you feel it in your chest? Which time of the day is it worse or better? The specific details of how you show up with a complaint. It's not just, for migraine, we give this, for anxiety, we give this, for depression, we give this. It's very individualized and specific to the particular situation and client. So how do we create our remedies? So they're brought about through what we call homeopathic provings. So instead of testing our remedies on animals, they're actually tested on people. So a substance is given to healthy people. So ideally, men and women of a menstruating age. The substance is unknown to the participants and to the one who administers it to them, but they take repeated doses of the substance, and all the symptoms which occur to them are noted by the participants and gathered in a schematic way. So, 80% of people taking a substance may develop, lower back pain, 30% may have a sense of anxiety, 40% may have, a headache, a throbbing headache. So, and then that's all, of course, if there was a bushfire in the local area, obviously it's likely that the participants would experience anxiety. So that's all accounted for as well. But essentially, we find out what a substance can do by testing it on people and seeing what symptoms it can bring about. And then that can be utilized to treat people suffering from those symptoms. We also get data on substances from, accidental poisonings, and clinical data where we see, a particular remedy seems to be very useful for treating a certain complaint or presentation. So in homeopathy, we try to give the minimum dose and take only as much of the remedy as is needed to get the response. So if a woman is suffering from morning sickness and you try a remedy with her, just give the remedy as needed. Once the morning sickness is settled down, there's no need to take any more doses of the remedy. That's in an acute situation. In chronic disease, it might be a bit different, but for acute situations, you take as much of the remedy as is needed. And then once the complaint has essentially gone away, just take the remedy again when the symptoms present themselves again. So it's an energetic medicine. It's not working on the same channel as conventional medicine, which operates at a chemical level. So you can take homeopathy alongside conventional medicine, which is great too. So as Kathy was alluding to, we've sort of slammed in the media, we're laughed at and mocked at by some people who make a decision, a very unscientific a priori decision, that homeopathy can't work because we're using such nanoparticles. Hahnemann actually started giving remedies in crude doses, but he found that it would cause a lot of symptoms, a lot of side effects, I should say. And so we don't know how, but he developed the idea of serial dilution and succussion, where a remedy is diluted, and vigorously shaken between each dilution, so that when you're given a homeopathic medicine, it's a very, very nanoparticles, almost the energy of that substance that's left. And so here's a little bit of a, just good to laugh at yourself. Just before you run out, use what's left to mix up another gallon. That's why homeopathy is such a bargain. And so some people decide that homeopathy can't work because there's not a crude dose. There's a very, very, very minute quantum energetic level there. In a sense, it's like acupuncture in a bottle. However, even though we can't say exactly how homeopathic medicines work, our clinical understanding is ahead of our theoretical understanding. We do know that they work. You know, we see them working, we experience them working, but we can't explain exactly how they work. But that's the same in conventional medicine. You know, aspirin was used for decades before it was understood to be a prostaglandin inhibitor. And xylocaine, which blocks the sodium channels on the nerve, you know, we still don't know how that works, but we do know that it works, thank goodness. So just the reason, you know, because we don't know how something works, it doesn't mean that it doesn't work. So what are just very briefly, what are the advantages of homeopathy? It's non-toxic. So when you're talking about, you know, women during pregnancy, they're very concerned about taking, rightly so, conventional medicines if they're not necessary. You know, taking chemicals, you know, we do know of medicine, you know, medicines and drugs that have been recalled that have bad side effects. So that's a great advantage. They're safe and there's no side effects. I mean, if you took a high potency remedy for a long, long time when it wasn't indicated, you would develop some side effects, but they would go away. There's no medication that you put on and you said, this is it for the rest of your life, and you have to bear with the side effects. As I said before, it can be taken alongside conventional medicine. So somebody could be taking medication for high blood pressure. We can put them on a homeopathic medicine, and then in conjunction with their GP, reduce their conventional medicine over time. It's not tested on animals. It's environmentally friendly. It's cost effective. It's holistic. You know, somebody can come, they're concerned about their eczema, and you treat their eczema, and at the same time their extreme, you know, period pain will go away because it's holistic. It can work very quickly, and it can alter your susceptibility to disease. If, you know, a significant number of people in your family have contracted, you know, a disease, working with a registered homeopath over a period of time, you might be able to alter your susceptibility to developing that. And it's great, of course, when conventional treatment doesn't exist, or the side effects are just so horrendous, or, you know, things like IVF is very expensive and emotionally demanding. And, you know, why not try homeopathy first? And it can prevent the overuse of antibiotics. If a child has repeated ear infections, it's much more advantageous to have them utilize homeopathic medicines to resolve that and work with that, and then save the antibiotics for when they really need them, you know, if they ever need them. So homeopathy during pregnancy, it's, as we've said, safe during pregnancy. It's non-toxic, just with one caution: to avoid during the first trimester taking Coliphylum, Cimicifuga, and Thuja, which are 3 homeopathic medicines. Coliphylum and Cimicifuga and Thuja, they can be used to induce labor. So we just want to be careful that we don't take them during the first trimester in case it could lead to some contractions. And taking homeopathy during pregnancy can increase a woman's vitality, you know, her energy and her sense of well-being. She may come with, you know, morning sickness or backache or hemorrhoids or whatever the complaint is, and that may resolve and get better, but also she gets a sense of well-being and vitality as well, which is a bonus. So what can homeopathy be used for during pregnancy? Virtually any complaint that can arise during pregnancy, homeopathy can hopefully assist with. Morning sickness, constipation, hemorrhoids, varicose veins, threatened miscarriage, preeclampsia, toxemia, breech position, gestational diabetes, anxiety, depression. So as I said earlier, homeopaths are looking for the specific presentation of how somebody shows up with a complaint. So we'll dive into now having a look at just a few remedies for morning sickness. But before that, I wanted to sort of have a look at how we would differentially diagnose, how we would sort of look at the case to decide whether a woman needs one particular remedy or another. So is she worse in the morning, the afternoon, or the evening, or is it constant? Is it worse before or after eating? Does eating relieve her nausea or make it worse? Is there a loss of appetite? Does vomiting relieve the nausea or not? Are the symptoms worse or better from motion? Does the smell of food make her worse or not? Is she more thirsty or not? Are there concomitant symptoms such as headache or constipation? You know, since she's had the morning sickness, she's been constipated, which she's not normally. And what's her emotional state? Is she indifferent and just wanting to be left alone? Is she weepy? Is she irritable? So these are all of the things that a homeopath might take into account when we're trying to identify the right remedy or an effective remedy for somebody suffering from morning sickness. So just having a look at, say, 3 or 4 remedies. Cocculus is one where the morning sickness feels like travel sickness. You know, when you're on a ship, you're going on the inter-island, or if you're in New Zealand between the North and the South Island, it's a really rough day. And you've got that lurgy feeling in your stomach, your head feels like it's swimming. And yeah, the sensation of the morning sickness is like travel sickness. Then cocculus can be a very good remedy. You can see here on the left how that is the plant that it comes from, but when you receive it as a medicine, it might look something like that. You know, cocculus is also a great remedy to have when you've got a lack of sleep. So if you're up all night with a young baby and you feel like, you know, you've got that exhaustion where your head is swimming and you just feel almost nauseous with tiredness, cocculus can be a good remedy to reset the system and allow you to rest. So sepia is another huge hormonal remedy for women, and it's actually made out of the ink of the cuttlefish. There's an interesting story about how that was discovered, but maybe another time. Sepia is for the kind of morning sickness where the woman feels nauseated at the thought or the smell of food that before pregnancy she loved. So prior to pregnancy, she loved pizza, and ever since pregnancy, if she smells cheese cooking or a pizza, she's just extremely nauseous. The nausea is better for eating or drinking a little bit, and she might also be adverse to her partner, have no sexual energy and desire to be alone. She might crave vinegar and sour things. She might be depressed and weepy. But if you see a woman who's nauseated at the thought or the smell of food that before pregnancy she loved, you should think of sepia. Another remedy would be ipecac, and this is for constant nausea, you know, persistent nausea where vomiting does not even relieve the symptoms, which is dreadful. So there might be profuse saliva. She might be worse lying down, have a disgust for food, and she's usually not thirsty and often irritable. But you can consider ipecac when there is constant nausea, and when she vomits, it just makes no difference. Nux vomica is made from the seed of a plant. And in Nux vomica, somebody presenting with morning sickness, the epigastrium feels bloated and especially tender to pressure. There's nausea, especially in the morning or after eating. And there's often stomach cramps and much retching. Sometimes the vomiting relieves the situation somewhat. And sometimes you can have extreme nausea and desire to vomit, but you can't. There might be a sour taste with acid tasting vomit, ravenous hunger, and you might be irritable and easily offended. But if there's that bloating and tender to touch, and they're worse, especially in the morning or after eating, you can consider Nux vomica. So we can Another useful tool for another thing that can be done during pregnancy is possibly changing a breech presentation. So before 36 weeks, it's sometimes possible to change a breech presentation with a homeopathic remedy. It's probably best to consult a registered homeopath for an individual prescription, but one I can suggest is Pulsatilla. If you give the woman Pulsatilla 200C, just one dose, and then wait 3 days. If nothing's happened, you give another dose and see what happens. If that doesn't work, you probably need to consult a homeopath for a more individualized prescription. But Pulsatilla is another well-known female hormonal remedy. So Pulsatilla 200C, and repeat it 3 days later, just one dose. So this is a case of a woman with a transverse baby, and it was lying horizontal at 38 weeks. It was her second baby, and she was upset and anxious and didn't want to have a cesarean. Rather than trying to change a transverse baby at 38 weeks, that wasn't my focus. I gave her a couple of remedies for fear and anxiety, rather than attempting to turn the baby. But she took the remedies for over 2 days, and then she had an appointment and she was told, your baby has moved and it's head down, and she birthed vaginally. So that's the beauty of homeopathy, the holistic nature of it. Sometimes we can be aiming for one thing, but if the other thing is the right thing to happen, that may occur as well. So that was a really good result for her. So what about homeopathic medicine during labor? It can be used for all of these things. Overdue labor can be used to bring on contractions, during labor pains, to progress the labor when it stalls, and to assist the woman mentally and emotionally during labor. Just a little bit of research. This is on complication rates. So this was a randomized double-blind trial involving 93 women with a combination homeopathic medicine, and it was used to determine its effect on complication rates. So the medicine was used by the woman from the beginning of the 9th month of pregnancy, and the rate of complications for those who used the homeopathic combination was 11.3%. while the complication rate under placebo was 40%. So that's a huge difference, basically a 30% reduction in complication rates by using a combination homeopathic medicine during their last month of pregnancy. And another one is coliphylum. 22 women experiencing their first pregnancies were given homeopathic coliphylum, and their labours were compared to 34 women's labours who were not given coliphylum. And on analysis, it was found that the woman given coliphylum had a reduction in the duration of their labour by an average of 90 minutes, which is great. Coliphylum is one of the remedies that we may use to bring on stronger contractions or to start a labour off. So before labour, obviously, the woman is not going to be sitting there with a homeopathic kit during labour, reading up and trying to determine what remedy she needs. So it's important to have a person designated to be responsible for prescribing the homeopathic remedies during labour, either the midwife or the partner, the birthing partner. You know, it might depend on which country you're in, what the regulations say about whether a midwife is able to administer homeopathic medicines with consent or not, but the partner surely can. And it's good to have a birthing kit of remedies prior to the labour and to know how to use them. It's also good to have a professional homeopath on standby, maybe to consult with if needed in the heat of a moment. So routinely useful birth remedies is Arnica montanica. Even for people who've never heard of homeopathy or haven't utilised homeopathy, many people have heard of Arnica. It's a #1 trauma remedy. So it's good in labour if the woman is getting exhausted. It can give her that extra boost, and it promotes healing, can help control bleeding, prevent and reduce swelling and bruising, and relieves the sore, bruised feeling after birth. So it's a good remedy to give sort of routinely, maybe a 200C of Arnica during the labour, and continue after the labor. Maybe put the 200C into some water and just stir it throughout the day and just keep drinking it after the labor. Vellus perennis is for deep tissue injury where arnica doesn't really reach. So that bruised soreness, especially of an abdominal wall or the pelvic organs, when there's been a more intrusive labor with cesarean and forceps. And it's great for overstretched uterine ligaments. And this flower here is what Vellus perennis is. Aconite can be used for shock and fear. So if the woman's going into a feeling of panic at any stage during the labor, her heart is racing, aconite is a great remedy to take. It's good probably during labor to have a 200C because it's an intense sort of situation. For a standard first aid kit, most remedies would be a 30C. That refers to the strength of the remedy, but ideally a 200C during labor. But if you have just a 30C, then it's definitely worth using as well. Calendula is great remedy for wound healing, lacerations, cuts, and episiotomy. So it helps reduce the pain and heal the wound with less scar tissue. So you can get calendula cream to put on a wound. Arnica shouldn't be applied to a wound or a cut, but calendula is the one to go for there. And carbo-veg is a good remedy to consider when there's trapped wind after a cesarean. Coliphylum, we don't use it routinely, but when indicated, it helps produce strong, effective contractions. As we saw in that research, it reduced the woman's labor by 90 minutes. Where there is wandering contractions, so if the contractions are going all over the show but not really being effective, or if the labor stops and stalls, you can consider coliphylum. And chamomilla, when the birthing woman is in a state where she feels that the pain is unbearable and she's very oversensitive and has a violent bad temper, chamomilla can be a great remedy to utilize in those situations. It's also the biggest remedy for teething. When a baby is going through teething, they can have a pretty bad temper and be out of it because the pain of the teething is quite intense for them. Gelsemium, sorry, there's no picture there, but the laboring woman would have droopy eyelids and be in a state of exhaustion. She almost can't open her eyes and the labor is slow and sluggish. You might think of gelsemium. This is a remedy that's often given during the flu when, you're exhausted and you have that kind of headache and exhaustion and just the eyelids are not opening. Hypericum is a great remedy for nerve-rich areas of the cocculus and spine. So pains are intense and sensitive to touch, and there might be shooting pains up the trunk or the spine or down the legs, and it can be useful after episiotomy and cesarean. Calicarb is for backache labors where the pain is in the lumbar spine and the thighs. There might be a posterior presentation and where the labor gets stuck. Calicarb, which is a mineral-based remedy, can be great for that. Just wondering how I'm going for time. Kali Phos is a remedy for exhaustion in labor. So also sleepless nights after labor, it can help boost energy and just give you that boost in labor when the woman's flagging. Again, that's what it would look like in its crude state, but you might be able to get it as a tissue salt to take it, for a nursing mother.
Raya, just to interject, you've easily got another 10 minutes.
Oh, lovely. Thank you. So Staphysagria is a good remedy when the woman has anger and resentment or a feeling of humiliation after medical intervention during labor. So maybe there was forceps, episiotomy or cesarean, and the birth didn't go as she wanted. And she feels, even if she realizes it's illogical, that she's happy, she's got a wonderful little baby and it needed to happen, she still feels, anger and humiliation or resentment. Staphysagria can be a good remedy to go for there. So homeopathy for postpartum, I won't read all that out. You can sort of have a quick look and see what kind of things homeopathy can be used for. Pretty much everything after postpartum. So a bit of research, we've got 71 postpartum women who were not breastfeeding due to lactation pain were divided into two groups. One was given placebo and the other group was given a mixture of apis and bryonia, two homeopathic medicines, to determine the effects on lactation pain. And a significant improvement was noted in the group using the homeopathic preparation when compared to the placebo group. And that's in the Gynecology, Obstetrics and Biological Reproduction Journal. And another one, 40 women experiencing postpartum bleeding were randomly assigned to receive a mixture of Arnica 30C and Bellus perennis 30C or placebo. And the mean hemoglobin values were measured at 72 hours postpartum. It was found that those women given homeopathic therapy experienced significantly less change in hemoglobin levels than placebo. So in postpartum hemorrhage, the first remedy we think of is arnica, but there are all these other ones which you would have seen come up for some other issues. So carbo-veg was good for trapped wind after cesarean, and aconite is good for fear. So homeopathic remedies can sometimes, they have multiple uses. You don't just use them for one situation. Sabina is another remedy we can think of in postpartum hemorrhage, where with a Sabina presentation, there'll be very forceful, profuse bleeding, and the blood is bright red, or it can be dark red at times, but it has dark clots. Yeah, there may be fever and inflammation. There may be very little pain, but what pain there is wraps like a girdle from the sacrum to the pubic area, and the slightest movement triggers more flow. Ergonon, there's profuse bright red blood, and it comes in great gushes after the least motion of exertion, comes in fits and starts, that can be painful for the woman to urinate, and or rectal or bladder irritation as well is prominent. Homeopathic, the flow is usually dark and steady and slow and passive, so it's quite different to the other ones, although it can be active, red and profuse. She usually does not exhibit any anxiety or alarm about the hemorrhage, so she's quite relaxed about it. And there is much soreness in the abdomen with a hammering headache. So remedies for retained placenta. There's some of them. Some of them we would have seen come up before. Caulifilum, you know, for inducing contractions, and sepia used for morning sickness. So cantharis is actually the Spanish fly. So it's a remedy made out of the fly. And that's when there's no expulsive contractions present to expel the placenta. There's just nothing happening. And there may be a burning pain in the pelvic area and in her back. And the entire abdomen is very sensitive. The os may swell, and then she might be quite feverish or may vomit. Caulifilum, after a long, exhausting labor, and there's just not enough energy left, and the uterus might be hypertonic. There's generalized weakness, physical and nervous exhaustion and trembling. And if the woman needed the remedy during labor, think of repeating it now when she has the when she's needing to expel the placenta. And Jusopim, the placenta is so firmly attached to the uterine wall that nothing seems to be able to dislodge it. It tends to occur in delivery when the os recloses, and especially useful after miscarriage. Now, just to freak people out, we've seen all these lovely flowers and plants and things, but the homeopathic remedies are made out of lots of things. So this is Pyrogenium, which is made of decomposed lean beef, and that's used in postpartum infection. So, you know, obviously, if there's a postpartum infection, notify the midwife and the doctor immediately. But Pyrogenium can be given for septic states where there's intense restlessness and where all discharges are horribly offensive. So postpartum depression, there's quite a few medicines that we can think of for that. A sepia state is where the woman doesn't bond with her baby and might even reject the baby. She appears indifferent to the infant and their needs and the rest of the family, perhaps. She's easily angered and irritated, and she has quite a distinct aversion to company. on following the birth. Ignatia can often be used when there's grief and disappointment over some aspect of the labor or the sex of the baby. You know, things did not go as she wanted. She didn't get the gender that she wanted. There might be crying spells with rapid change of moods, sometimes weeping one moment and laughing the next. It's also the main remedy to consider when there's a tragic outcome of the birth, where there's a grief. Maybe the baby has a birth defect or is stillborn. The woman probably sighs a lot and feels like she'll never sleep again. China Officinalis, which as we know was utilized for malaria back in the day, can also be used when a woman's very depressed after labor. She's lost a lot of blood during the birth and might be anemic. China Officinalis is a great remedy for when you've had a lot of fluid loss. She may be even suicidal or totally indifferent and apathetic. We're also considering sepia here. And she may have periodic episodes of elevated temperature. Aurum, or homeopathic medicine made out of gold. She's likely to be suicidal, and it's the deepest form of postpartum depression, and feels totally worthless and unfit to live, extremely oversensitive to noise, worse in the evenings. Consider this remedy when the woman has had a tendency to depression in the past, especially during winter months, and it's now aggravated postpartum. So we might just have to skip over. But homeopathic medicine can be great for breastfeeding issues, either insufficient or excessive milk flow, mastitis. You know, phytolacca is a very common remedy for mastitis when the nipples start to get hard and swollen, and cracked nipples and blocked milk ducts. And just, you know, going back to, is homeopathy a placebo? I know in New Zealand, a lot of farmers use, you know, homeopathic remedies for their cows, you know, cows with mastitis. So it really doesn't work as a placebo with cows. So yeah, as Kathy mentioned, I'm the founder of the Hormone Clinic. So I have a focus on hormone issues, migraine, PCOS, endometriosis, thyroid. I have a fertility program that's over 84% successful in 4 cycles, you know, for women of a certain age. I primarily work over Zoom or phone because I'm in a rural location, an hour out of Brisbane, but also operate out of a GP practice for people locally. And that's my website and my phone number. Thank you very much, Kathy, and everybody.
Oh, it's so great, Raya. You know, it's so wonderful to get those, have these really practical webinars when we're talking about actual remedies, you know, and actual symptoms. If anybody has any particular questions that we haven't covered off, or has topics that we haven't gone through, you know, put them in now, because we'll be winding the webinar up shortly. Just as a aside, myself, when I was for about a decade, I was a 24/7 on-call caseloading midwife, and wow. I did a lot of births, either home births or birth centre births, so primary care labours. Boy, I tell you, I would have to say that homeopathy, I would estimate using homeopathy in labour probably saved literally hundreds of women from having an instrumental delivery. It probably one of the most amazing things to watch during labor would be those situations, and as midwives we all know that time when a woman is just, you know, she's fully dilated, she's pushing, but there is a moment where mentally she can just kind of give up and feel like it's just never going to happen. And, you know, it's one thing to be told in theory that, you know, pushing, that once you're fully dilated and you're ready to start pushing, that anywhere from, you know, a few minutes through to 2 or 3 hours of pushing is normal, and it is normal. You know, and so often you could see women where they might start, especially with first babies, because that pushing can take longer, they might you know, have given a really good 45 minutes into it, but there's just somehow they feel like, oh my God, you know, nothing's happening. And it is. So we know we've got a decentive baby going on. But when she emotionally just kind of goes, oh, I just give up. Like, yank it out, pull it out. I can't do it. I can't do this anymore. And she gets to this place mentally, and it affects her contractions. Her contractions become weaker. They start to space out. They're not as long. And, you know, it's very difficult logistically for her body to be pushing out a baby when her contractions are wilting away. And we know it occurs because of what's going on with her mentally and emotionally, spiritually. And so often, you know, I would just grab the little birth mix and go, let's just have this, you know. And honestly, people, I am absolutely not lying. What I would use it, say, every 5 minutes for 15 minutes, and that's it. Contractions are back up, and 20 minutes later, 10 minutes later, we've got a baby. It's absolutely phenomenal. Another thing I will tell you, which again is a true situation, is that in all of my years of caseloading, because there are midwives who do shift work when they go to the hospital and deal with whatever patients are there on the day, and you've got self-employed midwives who do caseloading, where they look after a woman, you know, through their pregnancy, labor, postnatal, etc. But after a decade of caseloading, which is the hard work, because it's a 24/7 on call all the time practically, not one client ever had a perineal infection or a cesarean wound infection from using Hypercal, which is homeopathy. So that's that combination of Hypericum and Calendula. Amazing, just phenomenal. You know, you can go over a decade and not one person have a infection. So I just can't speak highly enough of homeopathy. I just can't, and I could tell you way more stories. But we've so thank you.
I'll have to add you to the list of people, the famous people that advocate for homeopathic treatment.
I certainly advocate for it. Not sure about how famous in New Zealand. So we've got some last questions that have come through from Geraldine. So that was awesome. I have learned so much. Haven't heard of most of these remedies and what they're for. Thank you. It's good to know. Where are the plants growing?
Oh, okay. I'm not sure. That's a good question. I mean, homeopathic pharmacies make the initial tincture, so they would gather it from the local area, I guess, and be organic and everything, and they make it into a mother tincture, and from there the mother tincture is turned into a homeopathic remedy of different potencies. So they'll make different strengths of that homeopathic medicine, and then somebody like myself, a registered homeopath, orders that remedy in a what we call a medicating potency, and then I can turn it into you know, a remedy that my client will take. So and
the interesting thing with those stronger remedies, stronger tinctures, because usually, as you've mentioned, 30C is the stuff that you'll find that you can just buy across the counter, and say 200C is those stronger remedies that the practitioners will use. But the thing that makes no sense to science on this is that the more potent remedy is actually the more diluted remedy.
Yes, and that's a great point, Kathy, and that's because it's a quantum medicine. It's energetic.
It's a vibrational tincture.
And
you know, people go, well, how can that possibly work? Well, we know it works. What we don't fully understand yet is exactly how it works, and it's going to be about quantum physics science.
Exactly.
That will eventually work this out. But there can be no dispute that it works, because as you say, when you've got farmers using homeopathy on their cows, well, obviously that you know, there can't be a placebo effect going on.
Or chamomilla with a teething baby, which a lot of people have experienced.
Absolutely. That's right. When you're using it on a teething baby, they don't know, but instantly it works, you know. And So there really shouldn't be an argument that it works. And if there is, that's pure ignorance.
Yeah.
So the question is, how does it work? Well, yeah, one day the science will catch up.
What we're doing is the best
it.
understanding is that we're creating an artificial disease state. So if you suffer from asthma, I'm giving you a substance and that can cause asthma-like symptoms. It can cause asthma, if you like, in healthy people. And then because it's a bit stronger than your natural disease, it cancels out your natural disease and your asthma symptoms go away or resolve. Because Hahnemann noted that you can't have two similar diseases at once. You can't have, if I have the measles, you cannot give me the chicken pox. It's like that place is taken, you know. And so by creating an artificial disease state in somebody, like you have a bad migraine on the right-hand side once a month, I'm going to give you a remedy that causes a right-sided migraine. And then it's like the body says, oh, hang on, boys, we've already got this now, and your actual migraine goes away.
Yeah, it's absolutely phenomenal.
Yeah.
Yeah. So vibrational tinctures, and you know, at the end of the day, when I comment that it's quantum physics that will work this out, is because when we look at quantum physics, you know, we might appear that we're solid beings, but actually most of us, most of what we are consisting of is space.
Yeah.
You know, when you get down to that atomic level, you know, and you've got your valence shell on the outside and your nucleus in the middle, and going around there is nothingness. We are vibrational beings.
Exactly.
So that's why anyway, that's I digress, but it is amazing stuff, and I could tell you some incredible stories about using it on my kids growing up. In fact, really that was all I used on the kids as my first cab off the rank. So I would go, okay, tonsillitis, right? I get out my little book. This is before I was a midwife. I didn't really know much, but I got my little homeopathy book out, and I'd look up tonsillitis, and I'd give them the remedy, and hey presto, it's fixed, and they're over it. But the interesting thing is that those 3 kids are now all in their 20s, and they still have, to this day, have never needed a course of antibiotics.
Wow, that's amazing.
For their body to cure themselves.
Isn't that
we
great?
had one exception where one of our kids was working in a supermarket, bringing in trolleys, car park, and got bitten by a dog.
Oh, okay.
And I said, oh, I think we're going to use antibiotics on this. I don't know what's in a dog's mouth. And of course the doctor turned around and said, oh, well, do you know if there's any antibiotics you're, you know, allergic to? And the 19-year-old said, well, I've never had antibiotics. And now, you know, collectively, goodness, they'd be over 65 if we put all their ages together. And still none. So amazing.
Yeah, that's great. Wonderful.
And I blame that. Wonderful blame all on homeopathy, because when you use it as that first cab off the rank, the body does what it needs to do. And it helps cure itself. Somebody's asking if they can get a copy of the slides.
Sure.
So absolutely. So feel free to message through to Raya, and for her to send that through to you. But also tomorrow, tomorrow, sort of basically 24 hours from now or slightly before, you should all receive those that are registered for this webinar should receive an automated message from Zoom, and that will include Raya's details as well.
Sure.
And then a final quick question. I'm not sure if you'll be able to go through specific remedies, but somebody's asking what remedy would be used for a front left quadrant migraine.
We do need more details than just the location of it, but I can tell you that I have great success with migraines. It's one of my focuses, and I've seen amazing things with a woman came to me once with migraines that she'd had once every month, 3 or 4 a month for 10 years. And then after 2 doses of this remedy, a year later, she hadn't had a migraine. So, and it's not, you know, you feel like, oh, you know, it's not showing off. Like, showing off's not a good thing for Kiwis. It's homeopathy. It's homeopathy that's the amazing thing. You know, we're just the ones that deliver it. And, you know, like, it's just astounding sometimes the results that you see. So, yeah,
and
I would, yeah.
Question in your answer is just so sums up homeopathy, that it's about getting the therapists need to get the full picture on this person, to work out their constitution and what's going on, and then it becomes obvious which is the remedy. So say, for example, with coughs, there's probably about 50 different homeopathic remedies just for a cough. So it depends on all the specifics of the cough and more about that person. Yeah, so
there's about 6,000 homeopathic medicines at the moment. So we obviously use homeopathic software to help us identify in chronic cases medicines, because, you know, a remedy might have 600 symptoms and there's 6,000 remedies. So, you know, good luck remembering all of that. So we do need the holistic picture. So it's a conversation, getting all of the symptoms, and then we can give a good match of a remedy. Specific to that person. And the
joy with homeopathy is, you know, when it's a situation where yourself at home, or the therapist is sort of looking at it going, could be this, could be that. You know, not sure which is maybe the correct remedy. Well, you could just take both, you quite often. Or, you know, it's the thing with homeopathy is that if it's not the right remedy, you just don't
do no
get
harm.
Result.
Yeah, exactly.
So there's no harm caused.
It's a no-brainer. As a first port of call, why not try it? You know, it's no side effects. It's you know what I mean, like it's non-toxic. Like, I just can't see why you wouldn't do it.
Exactly. Well, I mean, based on you know, current science, there's nothing in it. There's no molecular structure within that liquid of of the original you know, the thing that was in it originally.
The substance,
So it's anyway, we need to wind it up, and it's been fantastic.
Thank you. No, thanks so much.
Raya, and thank you for everyone and your questions. And homeopathy and maternity just should be this.
The lady who wants to contact me, I can see there my email address isn't there. It's info@thehormoneclinic.com.au if she would like to email me for the slides.
Fantastic.
Okay, well, thanks everybody. Have a great day. Okay,
bye-bye. And bye everybody. Have a wonderful week.
Thank you. Bye.